Today we're here at some new offices for State of Franklin Healthcare Associates, Highlands Family Medicine in Johnson City, and I'm joined by Dr. Paige Gilbert-Green. Dr. Green, let's talk, because this is exciting. Y'all have a brand new practice here in Johnson City.
We do, and we're so excited to be here, Chris. Thank you for coming today. We are so happy to be here and serve our community in Johnson City. And we just opened on August the 2nd, so the office is very new, but we're glad to be here.
Why did y'all decide that this was a place you wanted to be?
Well, one of my partners and I, Dr. Johnson, have worked in academic medicine for several years, and she and I decided that we really wanted to come to outpatient private practice to be able to better serve our outpatients in the community, and wanted to bring a practice to Johnson City. And we're excited to join State of Franklin because they have just an excellent reputation. They take awesome care of their patients. And that's what brought us here.
Let's talk about the services that are offered here. I think it's in your name, family medicine.
That's right. We do everything you would expect from a family medicine practice. We see all ages of people, from infants, children, adolescents, older adults, and everybody in between. We are very excited to offer preventative care as well as sick visits, acute visits, and have some same-day appointments actually, and to offer all of the procedures that you would expect within family medicine. We do skin biopsies, we do women's health procedures, and one of my other partners, Dr. Robinette, and I are DOs, osteopathic physicians, and so we do osteopathic manipulative medicine, and that's another procedure we offer here.
Expound on that more if you would, just a little bit.
Yeah, sure. So when you go to DO school, you get all of the medical training that an MD would get, but you also get some additional training in kind of the musculoskeletal system. So it's an adjunct, especially for patients who have musculoskeletal issues or pain, and it gives you another way to treat them that doesn't require a pill, doesn't require a medicine, and touch is very healing. And so it's something that we're really excited to bring to patients in this community.
All right, Dr. Green, thank you so much for taking some time with us today.
Sure.
We continue our conversation with the physicians here at Highlands Family Medicine with Dr. Lee Johnson. And Doctor, you got to be excited to be a part of this brand new practice.
I really am. Chris, we've been open since August 2nd in this brand new practice, Highlands Family Medicine. We have an incredible staff. I have amazing colleagues, and we're just so excited to serve our community.
And talk to me about serving your community. You're a veteran, and we appreciate your service, but you want to make sure that everyone knows that you're looking for new patients, first of all.
That's exactly right. So after I finished my Army service, I worked in academic medicine for about 8 years, and my primary job was to teach and train resident physicians, which I loved. But then I was just looking for an opportunity to really invest in my patients and spend more time with them. And State of Franklin offered us the opportunity to create a clinic where we could really spend some good time with our patients, provide them quality care, provide a welcoming environment for all patients, and we're just loving it.
On a daily basis, talk to me about the services that you offer here.
Absolutely. So we provide comprehensive primary care. So we'll see young patients, older patients. We'll see young folks who are healthy and just need to come once a year for their physical. We see people with complex medical conditions who need us to walk with them through things like high blood pressure and diabetes. We provide procedures such as joint injections, skin biopsies, women's health procedures. We do a lot, and we have a good time doing it.
It sounds like you do a lot here, and you want to encourage, that's your message to folks, give y'all a try. I mean, you're like any other business. If you get somebody in and you do a great job for them, they're going to come back.
That's right. And so there's a lot of folks out there who are looking for a primary care provider who maybe have been putting it on the back burner and have put off just establishing a relationship with someone, and we'd invite them to come in and develop a relationship with us. We can schedule appointments a little ways out that works for people's schedule, and we also reserve some same-day appointments. If something comes up and you have some time and you want to come in and see us, we'd be happy to see you.
Very handy. All right, Dr. Lee Johnson, thank you so much for taking some time with us. We've now stepped into an examination room here at Highlands Family Medicine. I'm joined by Dr. Christian Robinette. And Dr. Robinette, let's talk about, I know you're smiling. You've been smiling since we walked in the door, but you're excited about being part of this group.
I am. I'm so thrilled to be here. My partners are amazing. We have built a staff here at Highlands Family Medicine that can't be beat. And I just can't wait to get more patients in and start building relationships with folks.
And that is an important part of practicing medicine, is those relationships that you do build.
It is the most important thing to me. I grew up in Elizabethton, and all I've ever wanted to do was take care of people here in my hometown. And I can't stand the thought of a patient ever leaving me or not knowing what happened to them. And so that's really why I went into family medicine, so that I could keep patients in my circle forever.
Y'all take a team approach to healthcare here at Highlands Family Medicine. Talk to me about that team approach.
Yes, sir. So that was something really important to me about joining State of Franklin. It is a huge network of care that can be provided for the patient. So we take care of our patients here in the clinic, but if for some reason they do end up having to go to the hospital, we have a whole group of State of Franklin doctors that take care of patients there. So we know they're getting excellent care there. They could follow them into the nursing home, and then we can get them back on track. And it's just been really wonderful to learn about all of the resources we have with pharmacists and nutritionists that we can also get our patients care by.
So let's talk about a typical day here. What do you do during a typical day here?
Of course. So we take care of all people, any age, stage of life. We take care of folks who are very healthy, who just need to come in for physicals. We also take care of folks who are acutely ill, like for a sick visit, as well as folks who have chronic conditions who may need help managing medications for things like hypertension, diabetes, heart disease. And so it's really a good variety. We take care of all different things every day, and we also do some procedures.
And like you mentioned there earlier, y'all are accepting new patients, and you kind of do some same-day medicine as well.
Yes, sir. So we are really excited to start building those relationships with new patients, and we really want to try to get you in as soon as possible and start building that relationship the day you call.
All right. Dr. Christian Robinette, thank you so much, and thank you to all of the physicians here at Highlands Family Medicine. Brand new practice here in Johnson City. They would love if you contact them today.